not just in Gujarat, even in the United States, the amount of patients, the percentage of patients who can reach during the golden hours is very less.
Yeah. And what possibilities of recovery they can expect from such procedure?
Well, the stroke has already occurred, so we will not promise any miracle.
Correct.
But
Yeah.
on the other hand, the rehab as well as the chances for them to get their functional recovery, we hope is way better. My message would be for the young neurosurgeons.
Good morning and welcome to a special podcast from Parul University and Sevashram Hospital, Vadodara. And here I am Dr. Vikrant Pujari, Senior Consultant Neurosurgeon, Head of Unit 1 here. And with me is our special guest here, Dr. Iype Cherian, and he is a world-renowned neurosurgeon and Director of Institute of Neurosciences, Vadodara. So we are developing an Institute of Neurosciences, and as you know, we are having various departments. We are having neurotrauma department, we are having vascular department, we are having onco department and spine department. So today we are having a special podcast on stroke and how to salvage the penumbra, right, Dr. Iype?
Yes.
And Dr. Iype is a renowned neurosurgeon for microvascular anastomosis and IMAX surgeries, and here he will tell us about stroke and the role of STA-MCA bypass surgery in it. Yes, good morning, Dr. Iype, and let me know, in the routine stroke, as you know, our window period usually is for that golden hours are for 3 hours. When the patient reaches to the hospital, and within 3 hours he can be given a treatment to reverse the effects of the blockage of the vessel. This is a usual story, but as you know, in Indian scenario, even in Gujarat, in your Saurashtra, where the conditions of the road and lot of other factors are there, where the patient is unable to reach the hospital and the patients land into massive infarct, and post they cannot get the 3 hours golden period treatment. So in this category of patient, can you tell us what is the role of our new STA-MCA bypass surgeries in these patients?
Yeah, thank you, Vikrant. It's a very poignant question because not just in Gujarat, even in the United States, the amount of patients, the percentage of patients who can reach during the golden hours is very less.
Yeah.
Now, when a stroke happens, there is, as we all know, there is an umbra.
Yeah.
And around the umbra, you have a penumbra.
Yes.
Now, the thing about the penumbra is that it is not dead, but it's also not functional.
Yes.
And one more important thing about the penumbra is that the plasticity shift, which means the function shift from the umbra, usually takes place into the penumbra.
Yes.
It doesn't shift to a few centimeters beyond. So it's very important to salvage the penumbra to something that is functional. In earlier times, we were doing EC-IC bypasses which were not selective and which could cause high blood flow and produce something called luxury perfusion and bleeding.
Yes.
On the other hand, we take a perfusion map of the brain after the stroke, especially in an incomplete stroke, and we identify the penumbra. If we can do that, we can specifically anastomose an ST branch into MCA region supplying that penumbra. This will result in the penumbra perfusion to improve. Over time, the functionality of that person compared to somebody who hasn't undergone the bypass will improve. We have seen that in about 50 cases over the last 7 years. Many other centers from United States, China, they are doing this.
Yes.
So it's time for us to get it in a big way. Make sure that the neurosurgeons, other doctors, and patients are aware about this possibility. The beauty is that the window period is 3 months.
Oh,
Even beyond that. But 3 months is the best.
yeah, it's a big window period. So the patient can come within this period and he can be benefited by this procedure.
Absolutely.
So that's very important, audience, that this window period, if you compare 3 hours and 3 months, usually patient doesn't reach the hospital within 3 hours. So when the patient is, after 1 month, if the patient of stroke is there and having a hemiplegia or paralysis is there, the patient, even within 3 months, they can come to our hospital and we can assess the patient and then we can go for these types of
Yes, if they are fit into the criteria, we can definitely go for this. I'm sure a huge number of patients will be benefited.
Yes. And what is your experience till now for such type of cases?
Yeah, so we've been quite select in this and our experience has been excellent.
Very good.
A lot of fellows who have come and stayed with us has seen this, and our patients from all over the world also has seen this. We even designed a set with Omedic Surgical so that usual anastomosis sets are very costly and they are not ultra micro neurosurgery ready, which means they are not ready for zooms over 20. So we designed the set and we made sure that the entire set is half the price of a usual Western derived scissors, so that we made it very cost effective and we made it extremely good as well.
Okay.
So we are trying to train surgeons from the third world and India and many other countries to start doing this, which can really change the landscape in strokes.
Yes. Now we are starting here also in our institute at Parul Hospital, these surgeries. So what is your message for these patients that when they can come to our center and what possibilities of recovery they can expect from such procedure?
Well, the stroke has already occurred, so we will not promise any miracle.
Correct.
But on the other hand, the rehab as well as the chances for them to get their functional recovery, we hope is way better than if the intervention is not done.
Yes.
And only more and more studies will reveal how better the patient will do. But in our past experience, this has been tremendously good for the patient.
Yes.
More than the patients, I think the message should be for the doctors as well as the neurosurgeons to pick up this skill and start doing it as a routine, because intervention may not work here and it is only the bypass which will work.
Exactly.
So my message would be for the young neurosurgeons from all over the world, from India as well as from every part of the world, to pick up the STMC bypass and select your patients correctly and employ these techniques using high zoom like in the exoscope or even with a microscope that is modified, and help the patients worldwide, because stroke is one of the major problems in neurosciences.
Yes, thank you. And I invite all neurosurgeons who are interested to learn this microanastomosis procedure. Dr. Iype Cherian will be conducting the workshop on microvascular anastomosis soon here in our hospital, in Salvaging Hospital. And even for the patients, the message is there that if they are having this hemiplegia or paralysis, and they are after 2 months presenting in the hospital and having a rehabilitation center, they are trying, then they have the hopes. For this procedure can be helpful. We are not promising, but definitely it can be a very helpful procedure to salvage the penumbra. And so at Parul Hospital, this is our project of our Department of Institute of Neurosciences, one of the very unique project, and we'll be trying hard to deliver for this. Thank you very much.
Thank you.